Hi, good morning, good afternoon, good evening, wherever you are, whatever time you're watching this. How are you doing? So my name is Jane and this is Overseas Nursing Bands, and you know what we do here? Everything nursing, overseas nursing. We talk about Osce tips, we motivate you, we coach you. Okay, so anyway, welcome back to my channel. If you're new here, welcome, thank you for joining. And if you been here and returns all the time, thank you for staying with me. You're really thank you. And yeah, at the end of this video, if you you can share, you can like and comment if you think it's going to be beneficial to someone. Okay, so right now, you know what we do here, we want to find out how you're doing. So how are you? Okay, good. But remember, you are very important. Self-care, it's very important and essential. Mental well-being, because we want you just not just to be sane, but to be well as well, totally holy. Yeah, and having writing exams and everything like that is a very stressful time. Writing exams is a very stressful time. Adjusting to a new country, all the processes of trying to get registered here, it's a very stressful. We cannot even lie about that. It's very stressful, but the most important thing is that you're taking care of yourself. It's very essential. All right, so now that we've gotten that out of the way, let's get into our video for today. I have been going through the what is it called, the evidence-based practice. We said we'll take a few topics on evidence-based practice, and we've taken a few topics. I think, is it 2 or 3? I think we should just make it, we should do 4 or 5 of the one of those evidence-based, and then we move on to something else. I'll check how many I've done. If it's 4, then our next video might be something else. Okay, anyway, so today we're going to do smoking cessation. Smoking cessation is one of the evidence-based practices that you undertake during your Osce, and like we all know, it's a silent station. You're not talking, you're writing. And as always, I repeat that in all my videos, please make sure that you have written your name, signed, dated. Is important because it invalidates your answering sheets. Okay, and then read the question, understand it, and you'll be given a scenario as usual, and you'll be given a few research summaries, 5 to 7 research summaries, and then you'll be given a question, your scenario to answer from those summative researches. And then what happens is this: you're expected to write at least 5 bullet points. You're not going to write as in it's going to be a summary. You're writing, your writing is going to be in bullet points. You don't want to be writing so many. You don't want to waste time. So as usual, I'm saying that you should be able to have this in mind. Whatever scenario, I'm not going to give you a scenario, but whatever scenario you're giving in smoking cessation, about smoking cessation, these are the answers that should follow. These are the answers that you should work with. Does that make sense? All right. So what's going to happen is that you're going to be summarizing the main findings from the main article, and it's going to say summarize the main findings from the article summary and draws conclusions, making recommendation for practices. Okay, summarizes the main findings from the article summary and draws conclusions, making recommendations for practice. As usual, write clearly, As I've always said, write clearly, write legible. Don't use unnecessary abbreviations. Honestly, write in longhand. Don't abbreviate, I would say, if possible. All right, so number one, you're going to be writing, you're saying that you will inform the patient. I will inform the patient that the replacement therapies have not been found to achieve the same level of satisfaction as smoking. However, e-cigarettes have higher rates of satisfaction compared with nicotine replacement. That's point number one that you are giving. Point number two, discuss with the patient that studies show that stopping smoking is more likely when using e-cigarettes than nicotine replacement. That's number two. You're telling this patient, so your bullet point, you're telling this patient that from after you've read a summary, you have your scenario. So this is what you're telling this patient. We go to number three. So that's 1, 2, and then this is number three. And it says that I will advise the patient that e-cigarettes are more likely to cause throat and mouth irritation compared with nicotine patch. How many points have we got there? 3. And then the fourth one is, I will advise that nicotine replacement therapy are more likely to cause nausea. Okay. Number 4, I will emphasize that without face-to-face support, there is low efficacy for both treatments and recommendations that the patient use a smoking cessation support device, signposting them to local services. I'll go through that again. So number 4, we've said, I will emphasize that without face-to-face support, there is low efficacy for both treatments and recommends that the patients use a smoking cessation support service, signposting them to a local service. So that's how many? 1, 2, 3, 4, 5. And then the next one, I will positively acknowledge the consideration of giving up smoking by offering support and encouragement. If you write all of this, that's it for your smoking cessation. It's all done, nothing more to add. So it's very straightforward. This is a very straightforward, it's giving it 10 to 12 minutes, but I bet you'll finish it in less than 8 minutes. Just read and know what you're going to write, read the summary, and then this is the answer basically for smoking cessation. That's just all that you have to do. I'm wishing you all the very best in this, and I hope you come back with your good news. Thank you very much. Bye. Take care.